Hello, everyone. Thank you for joining us here today. I'm Fabiana Bacchini, Executive Director of the Canadian Premature Babies Foundation. CPBF is a charitable organization, and our mission is to support and educate families of premature babies. This Preemie Chat series is one of the many initiatives we have to bring information for NICU families and healthcare professionals. Here every Friday, we talk with experts, researchers, and parents who share with us their experience and knowledge. Also on our website, canadianpremies.org, parents will find all kinds of resources and support, including the COVID Care Program, which is a program that we're offering free therapy sessions for families currently in the NICU or those who have been recently discharged. To apply for the COVID Care Program, visit the resource section on our website. And today, right here, we're going to talk about managing pain into the toddler years and beyond. Children who are born prematurely can experience pain into the toddler years and later in childhood from medical procedures or everyday pains. Frequent painful medical procedures include routine immunizations, blood draws, IVs, injections, and so on. Fortunately, there are a number of evidence-based strategies that can prevent or reduce the pain and distress from medical procedures, although these strategies are not always put into practice. Today, we'll describe some of the simple strategies to manage children's pain and distress and how they can be used effectively by parents, caregivers, healthcare professionals, and children themselves. And I have here with me today, joining live from Calgary, Dr. Katie Birnie, who is a clinical psychologist and assistant professor in the Department of Anesthesiology, Perioperative and Pain Medicine at the University of Calgary. She leads Partnering for Pain, an award-winning patient-oriented research program that integrates patient and family partnership and multi-stakeholder engagement to improve the prevention, assessment, and management of pain experienced by children and their families. Dr. Birnie is also an assistant scientific director of Solutions for Kids in Pain, SKIP, a national knowledge mobilization network working to improve evidence-based children's pain management through coordination and collaboration. She joined Alberta Children's Hospital as a medical psychologist in 2018, where she continues to provide clinical care. Dr. Birnie, thank you so much for joining me here today.
Thank you so much for the invitation and for having me, Fabiana. The work that the organization does is so phenomenal. So it's just a real pleasure to spend some time with you today.
Thank you, and I'm very happy to have you. And we are going to have a presentation and then a Q&A period at the end. So Dr. Birnie, you can share your screen. And if you're watching us from home, from the hospital, on YouTube or Facebook, please send your questions, your comments. We really want to hear your experiences with pain management for your children. So let's share your screen here.
Perfect. So I'll start us off just talking a little bit about pain in the toddler years and beyond, and really look forward to the question and answer period coming afterwards as well. I first want to start off by just having a shared understanding together, because not all pains are the same, and we actually need different approaches depending on the different type of pain to support kids to manage them. So one of the types of pains that we talk about are pains that don't last very long, they're short. They come from things like injuries, even just right after surgery, falling on the playground, medical procedures like needles, and those are what we call acute pains. So pains that really don't last a very long time. Then we have pains that last up to 3 months or longer. So these can be things like headaches, stomach aches, maybe pain associated with an underlying condition or a disease, and those are pains that we call chronic pains. So these are really important to kind of distinguish between this acute pain and this chronic pain, because what's happening in our bodies is actually quite, starts to change and is quite different. And so we need different approaches to manage them. The other part I want to start from is that pain in childhood is actually really common. So pain is certainly a universal experience. What we know from some great research that's been done in Canada is that hospitalized children continue to report a lot of pain that might be undertreated and is pain that we can actually do something to prevent. So this can be pain from procedures in hospital or the reason kids actually were hospitalized, but up to 3/4 of children, so 3 out of 4 kids that are hospitalized might experience what we might call moderate to severe pain. Often, like I said, from surgery or from medical procedures themselves. And especially repeated procedures that can make future pain worse, certainly can be really distressing for children and their families, can impact brain development over time. And if it becomes so distressing or so stressful, traumatic, even from repeated painful procedures that are poorly managed can be quite traumatic, it can actually lead to avoidance of medical care over time. But even in kids who aren't hospitalized, this kind of acute pain is actually really common, even from immunizations or the flu shot. So in most children, they might receive up to 20 vaccines before they reach adulthood. Chronic pain in kids is actually also quite common as well, more common than we might think. So it's as common as things like ADHD or other types of mental health concerns, and it can impact up to 1 in 5 children before they reach adulthood. Often it's associated with poor quality of life, so these kids are not spending as much time with friends, with family. They might be have mental health concerns that go with this, so depression or anxiety or trauma. And might often are not going to school or are missing school pretty frequently. And this can impact them into adulthood. And the part that's really important to note is actually health professionals receive not a lot of education about pain in general, but definitely less about chronic pain in kids. And many families actually struggle to access care specifically for chronic pain. The beautiful thing is that the research in this area and this field of pain in kids has really exploded over the last 40 or so years. So really, we only started doing research about pain in children in the late 1970s, early 1980s. And this shows all of the scientific articles. So every article that was published about pain in kids starting from 1975 until 2010. And you can see there's a ton of exponential growth, which has only continued to explode over the past 11 years. So we're really, really gaining a lot of really good knowledge about how we can prevent, assess, and manage pain in children, both from that infancy period as up into early adulthood. One of the big problems here, Canada is actually a real leader internationally in terms of pain research and pain science. But we know that this knowledge isn't always being put into practice. So there's a huge gap between when we actually start to do research about something and when it actually reaches parents, caregivers, and health professionals in their day-to-day lives. And it's estimated to take about 17 years for this to happen. And this isn't in the area of pain. It's something that's kind of cross-cutting in different areas of health research. So we really need efforts that can really make sure that new research is being accessible and impactful every day. And so that's one of the organizations I work with that Fabiana mentioned is called Solutions for Kids in Pain, or SKIP. And that's really the focus of SKIP. So we're what's called a National Knowledge Mobilization Network. And that basically just means that we're really working to make sure that research evidence is reaching the people who can use it every day as quickly and effectively as possible. And we're doing this through working with other organizations and with people through coordination and collaboration to really improve children's pain across Canadian health institutions. We are based at Dalhousie University in Halifax and co-led by Children's Healthcare Canada, and have 5 regional hubs across the country, one in Edmonton, close to where I am, one in Ottawa, one in Toronto, a new one in Montreal, and one in Halifax. And we have a large network of people who are really focused on this mission together. The other part about SKIP is that we're what we call patients included. So this means that we're working with people with lived experience, so youth themselves or parents or caregivers who are really invested and have their own experience supporting kids with pain in childhood or with it themselves throughout the whole organization. So as members of our board of directors, members of our staff, as well as in all of the activities that we're doing together, the tools we're creating, they're co-designed, co-developed, and shared by families, caregivers, and youth. And all of our activities really focus on 4 key areas to improve pain in kids. So how do we build this awareness and urgency that pain in children is really important? How do we produce tools with the evidence that are really important, that can actually make a difference, or evidence-based ways to manage and prevent children's pain? How do we facilitate change to make sure that every child, every time they go into a hospital or a doctor's office, are really getting the best pain care that we know based on research? And how do we make sure that we gather research and evidence that already exists and assess readiness for people to actually adopt those now? We're doing this in partnership with many different organizations as we work together to improve children's pain. But I want to just spend a bit of time talking about what are some of those strategies that Skip knows from the research and is really working to mobilize and improve children's pain across the country. And what we know is that really no matter what type of pain we're looking at, a combination of different strategies is often the most effective. So this could include pharmacological strategies, so different pain-reducing medications. It can include psychological strategies, so things that might be relaxing our body, dealing with our thoughts, our nervous system in terms of relaxation, as well as our behaviors, and those physical strategies. So whether that's positioning or whether that's physical activity, physical therapies, and exercise. Often the most impactful pain management is really when these 3 strategies are done in combination or come together. So what does that look like for injuries? So for these everyday pains that toddlers might experience, or for medical procedures that children might have to undergo that might be painful, needle procedures being some of the most common. And what I've put up here are some examples. Alberta Children's Hospital has something called Commitment to Comfort, but lots of different places use different names for many of these same strategies that are really based in a huge body of evidence. So first off, it's really important to make a plan. Have a conversation about what are the strategies you're going to use, whether that's a conversation with the health professionals or whether it's a conversation with your child themselves, depending on how old they are. That can make a really big difference in how nervous or worried someone can be about an upcoming procedure. Things like topical anesthetics or numbing creams can be really helpful to put on the location where something like a needle procedure or another skin breaking procedure might occur. And it really just numbs the area for a short period of time. Comfort positions are also really helpful. And this is really being able to hold children in particular ways that bring them comfort, help them to relax, help them to feel safe and secure when a medical procedure is happening. And I'll show you some examples of those, but often mimic things like holding a child in a hug or really providing them with that comforting embrace. Certainly for younger children, breastfeeding or sucrose can be really powerful in terms of reducing or preventing pain from a painful procedure. Using distraction can be really helpful as well, and I'll show you some examples of that. But essentially it occupies the mind, so we have a less ability to really pay attention to those pain sensations coming through our nervous system. Distraction can be really helpful for those like everyday pains, like scrapes, cuts, bruises, those kinds of things, but also work really powerfully when we plan ahead in medical procedures. And then using what we call positive language, or at the very least, neutral language. So really trying to avoid giving a lot of reassurance, like you'll be okay, or I'm sorry this is happening to you, but instead using words that really focus on the child's good use of coping strategies, things that they're doing really well, like taking deep breaths, and also being really honest and truthful. We don't know what a child might experience or how painful something might be. But better to say, we don't know what that might feel like for you. Some people say it feels like a pinch, a brief pinch, but then it goes away, rather than telling them that it won't hurt at all, and then perhaps it does. And that can lead them to become quite distrustful. So some examples of great distractors and relaxation that's built in for these: taking deep breaths, blowing things like a pinwheel, listening to music, talking about something fun with their parents, planning a birthday party, something fun that they've done in the past. Certainly games can be really helpful. Many of us have smartphones, so there's lots of great distractors on there, whether it's a quick video your child likes or a game they like. or reading a book, or looking at a picture book, or a visual search book, can all be powerful ways. And then the Make Foundation has this great handout that looks at different comfort positions. So you can sit side by side with the child on your lap, back to tummy, so they're kind of sitting on your lap in a hug, or really like in a hug, what we call tummy to tummy, or back to tummy on the table sit. So those are all ways that parents or caregivers can be providing some comfort to their children that can help reduce painful procedures as well. There's some great handouts that go over a lot of these different strategies together. And you can also see an example that I did with my own daughter before she got her flu shot last year, which was really combining a lot of these strategies together, about numbing cream, counting or singing or taking deep breaths, that she preferred to look away from the needle, whereas some children might like to look. To have a fun Band-Aid at the end, have a stuffy with her, but also build in other things like, a potential reward or something that she could get afterwards to look forward to. And knowing what her job is, right? That can also be really empowering for children to know, my job is to stay still, use my coping strategies, and keep my brain busy with some of those distractors. Some of the strategies that can help for chronic pain is quite a different shift. So in acute pain, we focus on how do we prevent and reduce the intensity of the pain and how upsetting it could be. But in chronic pain, we need a bit of a different approach, which oftentimes feels a bit counterintuitive. But because of the changes to the nervous system that can happen with chronic pain, we actually need to focus on getting kids back to doing some of the things that they want to do and that they need to do. And then we notice that the more that they get back to those functioning things, that's when we start to see pain intensity reduce. And if you're interested, the World Health Organization, with an international group of experts, just published new guidelines based on the best evidence on how we manage chronic pain in children. And I put the link there to those guidelines. It's not a really long document, so it is actually pretty consumable, but really touches on 3 areas. So physical strategies like movement, exercise, gradual activity, different types of psychological therapies, again, that build in our relaxation, strategies that cool down our nervous system, like deep breathing, guided imagery, or mindfulness. Improving our sleep is something that we know can have a cascade effect to improve pain for children. And also often thinking in more realistic or more balanced ways. Sometimes when we're dealing with pain for long periods of time, we can start to have really understandable but challenging thoughts that make it hard for us to cope. So will my pain ever go away? The last time I tried to do this, my pain got in the way and I couldn't, or this is very frustrating. And sometimes those thoughts can actually be the greatest barrier to improving pain over time. And then those behaviors. So how do we actually engage in these relaxation strategies, these good sleep habits, and the physical therapies we're talking about? And also medications can sometimes play a role for some children as an important strategy. And that can really depend on the type of pain your child may have and where it is in their body as to which and what types and how much of certain medications can be helpful. Some great resources if you're interested in looking more, as well as children move through childhood and towards those teen years. We really want to build their own management, their ability to feel confident and competent, that they can do some things to manage their pain as well. But I want to definitely underscore the role that parents and caregivers play in their children's pain management. So you can see this picture of a dad whose young infant is getting a needle. And you can see by the look on his face just how distressing that is for that particular dad. And certainly, especially if we've seen our children go through many painful procedures or lots of medical or health encounters, I think there's a lot of increased, really important recognition of the trauma and challenge that can come for that for parents. But those comfort positions I showed, making a plan with children, being able to stay and manage your own stress in the moment can be so valuable by focusing on the helpful ways you can support your child. As many people know and have experienced themselves, kids can really pick up on that stress or worry that their parents might have. So ways that we can manage our own stress or worries in those moments and support them to focus and play a role in keeping them distracted, those comfort positions can be a huge asset. And then, of course, in the context of chronic pain, there's also a key piece there too. Being able to provide comfort through validating and appreciating kind of the challenge that kids can be experiencing by living with chronic pain, but really supporting them in that gradual strategies to get back to the things that they want to do, that you want them to do, and really engage in some of those day-to-day family things that we want them to be doing, even though pain may be present over time. So SCIP is really, just to kind of wrap us up through my presentation part, SCIP is really into kind of our second year at the moment, and we're building a lot of momentum. We've got a huge presence on social media. We're creating tools and resources. We have a great new website to check out where a lot of this information is. Trying to share in the media, conversations like today, and really trying to reach health professionals, policymakers, youth, families, and others who are really interested and invested in improving pain for children. And of course, feel free to get involved. Check out the SCIP website. We're on social media. Often use the hashtag. The hashtag we use is "It Doesn't Have to Hurt." And we also have a SCIP newsletter. So you can sign up. It comes out every month and can give you some good updates on the different activities and resources that are happening, new science in the area of pain in children.
Okay, Dr. Birnie, thank you so much for your presentation. So many good and important points there for parents, for any parents, not only parents of premature babies. This information obviously is for any parent who has a child who afraid of needles or gonna fall on the playground. But I want to unpack a little bit of your presentation because this is such an important topic, and I don't think we talk about enough pain in our community, in the hospital. So I want to start congratulating you first of all, because I think it is an incredible initiative to really make this information available for families and teach us how to advocate for our kids when they need, to be taken care of in a hospital or in a doctor's office. So thank you and congratulations for the second anniversary. This is so great, and CPBF is very happy to be involved in this initiative. But I want to go back to why it's important to raise awareness on children's pain, because we don't talk about pain enough.
Yeah, it is. You're right. I completely agree with you, Fabiana. And I think sometimes we dismiss pain because we expect it to be present. So we expect that because of either our own experiences as parents or because of what health professionals say or, how it is. Sometimes we think that everything is being done that could be done, or that, of course, my child is going to experience this great distress and pain from a needle, for example, when in fact there's often more we can be doing, and that's really why we want to kind of bridge that gap between it, right? And make sure that people are learning about the strategies, because often it's that, not that the strategies don't exist, is that people don't know about them or don't know how to use them in the moment. And it doesn't just go for parents and caregivers. It's health professionals too.
Absolutely. Let me just share here as we are talking your website to stay here so families can actually see and get all these strategies. But you are right, because not everybody knows about it. So, and I'll share a little bit of my piece with you, because my son has complex care needs. He's often admitted in hospital. And I didn't know about some strategies until I got involved with SCIP, that I learned that I could actually ask for a numb cream or the freezing spray for when he was having an IV or a blood work done. And one time he was admitted in a hospital and he needs an IV. And they just came to insert the IV. I said, no, he needs the cream. I asked for the cream. I didn't know the name of the cream. I said, I want the cream. Yeah. And then the person said, it takes too long to work. And so, well, but you're not insert an IV on my son without anything. And, but I had to advocate for that just because I knew from your work, the strategy and what I could advocate and ask for. So I'm always concerned about the parents who don't know they can advocate, because that wouldn't come natural for me. Because yes, when I was a kid, I had a lot of needles and There was no strategy, just hold your arm and, there you go. So I didn't know there was such a thing. So how can we make this information more available for families and healthcare professionals so there is no such a conversation or it takes too long to work? Because that is not only a parent problem, that is a system problem.
For sure, it is a system problem. I agree with you. And in addition to, building awareness with parents directly to be able to ask, right, or feel empowered to ask. But I think we're also trying to tackle that from within the health system as well, because you're right. Certainly speak as like a pain champion for kids, but, there are, in an emergency context, we might not have time for something, but that's the exception, right? Oftentimes, many of these procedures are not happening in that kind of urgent, life or death kind of situations, but things that, we could wait half an hour, that's often the numbing cream, depending on the type of numbing cream you're using, takes about 30 to 60 minutes to work ahead of time. And to share with the audience as well, again, you won't always know this, but sometimes, a painful procedure might be expected, and you can get the numbing cream without a prescription over the counter at a pharmacy. So if you're taking your child for an expected kind of procedure and have the ability to do so, again, I know it's not hugely expensive, but it is a cost, right? Of course, it is something you can get and put on beforehand if it's a regular procedure that you're going for. But you're right, the system should be different to make that possible. So certainly with SCIP, we're actually also working to make that institutional change, to make it become the norm, that every child is offered this, that becomes standard practice, and that barriers related to time we can work around. And there are some hospitals and other children's health centers where there's experts in this area that can support families. I don't know, Fabiana, with your own family, but people like Child Life can be also huge advocates in partnership with parents and caregivers, especially for children who may have undergone a lot of procedures before. And there is a lot of really understandable stress, worry, anxiety about it because of past negative experiences. Sometimes we need to work in partnership, right? And not put that burden on parents to have to advocate, for their kids as well. Yeah,
absolutely. We have a question coming here from our live audience. Is sucrose just as good as a numbing cream? Is there an age limit before sucrose is no longer effective?
Yeah, this is a really great question. And there are people that really focus kind of on this sucrose expertise. Sucrose is really helpful in that kind of infant period. There is some evidence that it can be helpful into children, upwards of kind of 2. But after that, it really, sucrose just doesn't have the same impact that a lot of the other strategies have. And there probably are a few studies looking at sucrose versus numbing cream. But to be honest, we can use both, right? I mean, I think that's the really important message I hope to share too, is that a combination of strategies is often the best approach. And, there's no reason why we couldn't be using sucrose and numbing cream at the same time for the same procedure, in addition to things like, with a young child, comfort positioning, right? And all of those other pieces that can go together.
Absolutely. So you talk about parents' position and parents get involved, but you also mentioned in your presentation how parents respond to the procedures and the pain. And let's talk about that, because
sure.
For a parent like me in the beginning, I could not even look at the needle. But obviously, the circumstance of having a child in the ICU and a complex child, I kind of need to get used to it. But I still try to turn my face but I know my son looks at me right away before anything is happening to him to see my reaction. So let's talk a little bit about the psychology behind this.
Sure. And you hit on so many really important things, Fabiana, which I tried to allude to a little bit as well. I think perhaps even more commonly in families where for parents or caregivers who've had children in the NICU where there have been many painful procedures, there is a piece that's really can be really traumatic. About that, and certainly understandable that that can make it difficult, right? As children get older as well, and maybe still need to undergo frequent procedures. But you hit on it, something so important, which is your son looks at you, right? They look to their parents for cues about, is this a safe situation? Should I be worried here? And I think we can communicate a lot to our kids through in those situations through our words, through our facial expressions, through our nonverbal behaviors. And sometimes this is where we make decisions about who is the best parent to be in the room. Is there one parent that feels more able to stay calm and able to support their child to engage in those coping strategies than another? Sometimes we don't have those options, but that can be one consideration. Can also be a kind of thing to say, make that plan ahead of time for yourself too. We're making the coping plan with our child, but what are some strategies you can use as a parent? Taking some deep breaths, really giving yourself an action plan. My job in this moment is to hold my child in this particular way, to, especially if you're using distraction, you can engage in the distraction, ask them questions about it. That helps them even more and can help distract you in the moment as well, right? So, there's ways that you can kind of try to manage some of that really understandable distress or worry that can come up for you as a parent as well, and really channel that into your role and the behaviors you can make in the moment to support your child as well.
Absolutely. And you talk about something else that was very interesting, the words that we are saying to the kids, how they are doing. Because as a child, I always remember, it's not going to hurt. It's going to be 1 second. It obviously hurt because it was an injection, right? And I had a lot of infections when I was a kid. So I still remember those things. Oh, I'm just going to go to the dentist. It's not going to hurt. So how can we tell the truth? You put some words that are very empowering. So how can we encourage parents to use more of those words?
Yeah, the language we use can make a really big difference. And when and how we talk about things can make a big difference, because sometimes our instinct as parents and caregivers in these moments actually don't serve us as well as we hope they might. So a good example of this is also when we tell our children they're going to get a painful procedure, right? If they're nervous about it, if we're nervous about it, often we say, I just don't want to talk about it until it's about to happen. And then I tell them. Whereas that can actually lead to more distress, right? And more distrust that then every time I go to the hospital, is it possible I'm going to get sprung with this? Today we have to get a needle, as opposed to having a bit of a conversation, making a coping plan ahead of time. So that can actually reduce distress by talking about it up front, right? But our gut tells us we don't want to talk about it. And you're right, this reassurance thing is fascinating. This is where research can be really helpful for us, because it is instinctual to say, it's not going to hurt, or you'll be okay, or I'm sorry this is happening to you. But what we've learned from some really interesting research is reassurance actually cues to children. Instead of making them feel better, it actually cues to them, oh, mom is telling me there actually is something I should be worried about. By saying don't worry, she's actually communicating there's something I might worry about that is about to happen. So it can actually have the opposite effect that we really intended to. So instead, again, putting our language on the coping strategies, praising, reinforcing what our children are doing well. You're doing such a great job staying still. I see you taking some really great deep breaths. And when we don't know if something is going to hurt, we can say, some people say it feels like a pinch. But we don't know what it's going to feel like for you. Why don't you tell me afterwards, and creating space that, we're not lying, but we're also not out there creating fear by saying, you're right, it's going to be really painful, because that can also not be helpful. So better to try to use kind of neutral language and say, it might feel like this, but let's find out what it's like for you.
How about the use of rewards? Because, okay, let's have this procedure. Let's go for ice cream after. So what is your take on the rewards piece?
Yeah, I think rewards can have a really great place. Certainly when we're doing something that we know is hard, sometimes that extra thing, can just make it that much easier to get it done, right? Something to look forward to after the fact. Certainly not promising a trip to Disneyland for a blood draw that you have to do once a month. Too much, right? I know that's a big exaggeration, but we can get into, promising a lot when really, we want to keep that feasible. And of course, rewards with kids can look like so many different things, even getting to choose what's for dinner or, a movie night. There's lots of things we can build in that can be rewarding, that don't necessarily cost extra money or aren't kind of promising the world over something. But they can play a really important place in really helping us do things that are hard. The other part I would just mention to Fabiana is that it kind of ties this language and reward comment together, which is there's some really cool research coming out that how we remember something makes a difference for how it goes next time. So after the fact, having some positive things that have happened, or even trying to remember the experience in a neutral way. So even if it was hard, even if your child cried, focusing on things that did go well, focusing on even neutral things. What did you see in the room when this was happening? The colors of the walls, the pictures. That can actually make it more likely to go better next time. If kids remember something as really painful, really horrible, they're actually more likely to experience pain and distress the next time they have to go to a procedure. So things can kind of come together really well in how we talk about it as parents after the fact.
That is so interesting. And also, it reminds me of the Bravery Beats program that Sick Kids has. And I know many pediatric hospitals in Canada have the Bravery Beats or Journey Beats, the different names in different hospitals, because every time a child goes to a procedure or have to go for surgery or emergency trip, they get a bead. And I know my son loves his beads because he knows after he goes to Sick Kids, there is a bead to add to his necklace. So that is like, is a way for him to tell his journey, how brave he is, but also his little reward and the message he has from that day, the doctor, the nurse, letting him choose the bead for that specific procedure. It's true. The memories I think, are very important. And yes, my son loves Sick Kids, and horrible things happen to him at Sick Kids. He wants to go back, and every time he gets discharged, he said, I don't want to go home. I want to stay here because he likes the meal, the train that they have every day. They can choose. So there's a few things that, yes, the pediatric hospitals are so good at, but now we're going to bring all that to the community as well. Encourage and empower parents to advocate for their kids too. When you're almost on time, but I want to touch a little bit on chronic pain, because a lot of our patients, as you mentioned, do have chronic pain. And to be honest with you, I didn't know how to define chronic pain, right? Is this a pain that it lasts an hour today, but then it doesn't have pain for another 3 days, and then he has pain again? Is this considered chronic pain, or a chronic pain something that lasts consistently every day? And how do we deal with it?
Yeah, so chronic pain is really very broadly defined, Fabiana, as pain that lasts 3 months or longer. But within chronic pain, it can be what we call continuous, which is pain that is there all the time. But it can also be what we call recurrent pain. So happen more in episodes where we might have periods of time lasting hours, days, weeks, even in between, where pain is not present at all. And all of that can be considered chronic pain. And chronic pain can come from a variety of sources, right? So it can come from chronic pain is now actually noted as a pain condition in and of itself. So our nervous system can actually become sensitized and become producing pain. But it can also can be secondary to another disease, muscle pain, pain from our nerves. Even if you think a child who is in a wheelchair or other type of kind of seated assistance, you can even develop muscle pain or pain in our bones, just even from positioning over time, that can be considered chronic as well. So it's quite broad in terms of the types of things that can be considered chronic pain.
Okay. And the strategies are the ones you mentioned. You can attack with medication, physical strategies. Let's talk a little bit about that so parents remember what they are.
Yeah, again, taking that kind of multitude of approaches. So medications can absolutely be helpful. And as I was mentioning, depending, having a good assessment to figure out what is the cause or what's the type of chronic pain your child is experiencing can make a big difference. So if it's pain from muscles or bones, that's going to be different than if it's pain from nerves. Often different types of medications or combinations of medications can be helpful. But often physical strategies, so getting our bodies moving, our bodies can become quite deconditioned, right? If we're not using our muscles and bones actually quite quickly. And that can add to any pain that we're experiencing as well. And sometimes with chronic pain, we're also holding a lot of tension in our bodies, right? Because it's painful. So we can, those physical movements, even for some kids, it's active physical strategies, so where they're moving their bodies, but there can be passive physical therapies that can make a big difference, where maybe parents or caregivers are actually the ones moving, right, a child's limb or part of their body, and getting them back to activities that they might like to do, right? So for some kids, depending on their mobility, getting them out kind of for walks or getting them back to gradually playing sports, if that fits for them, right? If that's something that's within their mobility or their abilities. And then psychological strategies, being able to engage in, I was talking about sleep. Sleep, I mean, if you think about it, if we're tired, everything is worse. So pain is worse too, right? So certainly trying to improve our sleep can make a huge difference in terms of pain, but also building in relaxation strategies. So whether that's deep breathing, I mentioned something called guided imagery. Sometimes people use biofeedback, or other types of mindfulness, other types of strategies that can be really helpful for families.
Okay, Dr. Birnie, thank you so much for all your information, for sharing your expertise, and for your time today. It's so much appreciated. I think a lot of families always have questions about pain and how to deal with pain. So I think you unpack a lot of things. I'm certainly going to have you back to talk to us a little bit more about it. But thank you so much for your talk today.
Thank you so much, Fabiana. And just a key takeaway for people, there is lots of great strategies to prevent and manage pain. So if that's something you're thinking about for your child, check out kidsinpain.ca, and we're always sharing resources on our social media and newsletter, and working with the Canadian Premature Babies Foundation closely as well. And there are ways to do things. So the science and the research evidence is out there.
Awesome. Thank you so much, Dr. Birnie.
Thank you. Take care.
Yeah. And for all of you watching us from home or from the hospital on our YouTube channel or Facebook, thank you so much for joining us here today and for participating in our chat. All the live sessions and past live sessions are available on our website, and I'm going to share here the link with you, the CanadianPremies.org. And we are a charitable organization, and we believe that through education and support, we can empower families, ensuring they are ready to care for their premature baby at home. Visit our website, consider making a donation. Together, we can create a brighter future for all our families. And I also want to thank our sponsors, AbbVie and Water Wipes, for the Preemie Chats series. And I will see you again next Friday, 1 p.m. Eastern Time. Stay well.